Hello everyone, I'm Alex Alvarez from the Australian Graduate School of Management at the University of New South Wales, and I am here representing Group 5. We'll be discussing the COVID-19 strategy of the United Kingdom along with its changes and results. But first, a quick recap. The first cases of what we know now as COVID-19 were recorded in China in early December of last year. But the outbreak was officially reported to the World Health Organization on the 3rd of January of this year, once the gravity of the situation became clear. Over the following 2 weeks, China started implementing quarantines. Moreover, travel bans and border closures began worldwide as the virus reached pandemic levels. And by January 31st, the United Kingdom had reported its first case. But it wasn't until February that we finally knew what to call the virus. Think about that for a moment. It took longer for the scientific community to agree on a name for COVID-19 than what the virus needed to spread worldwide. Therefore, before we pass any judgment on countries like the United Kingdom for their apparent slow or inadequate strategies, let us keep in mind that these are life or death decisions, and that billions of dollars, not to mention the geopolitical balance of power as we know it, are also at stake. So it stands to reason that a European superpower with an overly complicated system of government, like the UK, would be less efficient than a country like New Zealand, for example. Nevertheless, precisely because the United Kingdom is a world superpower, one would have expected them to have enjoyed more success, especially after others had already implemented some or all of the following measures to lower infection rates, save lives, and avoid financial doom. These include increasing hygiene practices, promoting the use of face masks, imposing travel restrictions, testing and contact tracing, banning large gatherings, closing schools, social distancing, and prohibiting all non-essential work. The relative cost of these measures, of course, varies greatly, but the UK was notoriously late in adopting all of them, and cost alone could not have been the reason why, because some of the most widely proven best practices, such as frequent hand washing and promoting the use of face masks, are essentially free for any government to implement. Yet, for reasons that still baffle us all, the UK government chose instead to ostracize the use of face masks, at least until the Prime Minister himself became infected. I think we can all agree that it's not every day that every country in the world is trying to solve the same problem. So with such a plethora of examples of what's worked and what hasn't, we can only hope that the lessons learned can be more universally applied from now on.